All right, how's everybody doing? Welcome to the Shellcast presentation. If you're new here, we're gonna have a presentation by Dr. Tina, followed by a Q&A afterwards, so make sure to leave your questions in the chat. Whenever the session is over, we're gonna release a quiz / journal entry. Please take your time and fill that out to the best of your ability so you can reflect on this experience and really get the most out of it. Make sure to sign up for our newsletter on our website. And join us next week where Dr. Malavi is going to have a shadowing session about pathology. So whenever you're ready, you can take it away, Dr. T.
Okay, great. Hi, everyone. Thanks so much for having me. My name is Tina Ho. I'm a facial plastic surgeon practicing in the Philadelphia area. So I'm just going to take some time. It should be maybe 20 to 30 minutes to introduce myself, my background, how I made it and eventually became a facial plastic surgeon. And then I'm going to share a couple of cases, some before and after pictures to show from both the cosmetic and reconstructive side, some of the things I do in my practice. I'm definitely after that, I want to open up for Q&A just to give time for that. Happy to answer anything, whether it's related to medical school, my surgical training, even also just work-life balance. I am a fairly new mom now. I have a 11-month-old son, and happy to comment more, kind of the challenges or how I've my experience so far is not only like a female surgeon, but a mom surgeon as well. So I'm from the East Coast. I had some roots in the Philadelphia area, eventually moved to the DC suburbs, Virginia side, Springfield, Virginia. I attended high school there, went to William & Mary for undergrad, and then University of Virginia for medical school. And I'm someone who went straight through with my training. I had my own childhood reconstructive surgeries. I had like a large nevus that I was born with on my forehead, and eventually had a number of surgeries at CHOP. Had the nevus removed. It's something where if it's large enough, it could be potentially cancerous later down the road. And then reconstructive surgeries included tissue expanders and such. I had about like 10 surgeries between birth and 4th grade. With those experiences, I saw early on the positive immediate impact that my surgeon had on me, and I wanted to be in a similar role. So going from there, I really enjoyed doing the science and math, and went through undergrad being pre-med. I majored in neuroscience, and then also second major in international relations. And then I also had the opportunity to participate on a couple of medical mission trips, primary care based in Central America. If you haven't had that kind of opportunity, I highly recommend it. I think, not only to be able to volunteer and help with medicine, especially in underserved communities, but also if you enjoy traveling, seeing other parts of the world, and I think gaining perspective too. One thing I really learned well is where you're born, I think makes a big difference on kind of like your outlook, and affects kind of your outcome in life too. So it just gives you that grounded perspective, especially being American, what we have here in the States. So, and then eventually, applied to medical school. I think for me, I can speak about later if any of questions. I was lucky enough to do well in science and math through high school and in college. So I came in with AP credit, did a lot of extracurriculars where, sometimes even for like classes like organic chemistry, I crammed, last couple of nights before the test, probably shouldn't. I guess I realized maybe didn't continue the best study skills. So for me, the MCAT was probably the hardest exam I've taken or struggled with. I felt like, okay, if I've done well, I gotten A's, done well to this point, I should be okay. I ended up taking the MCAT 3 times. Like I took it once, so I did okay, and then wanted to take it again, and then my score went down. So it's something where I realized later, especially when you're in this small pool of really talented and high achieving individuals. I saw this in medical school, so I became very average. So for me, I had to eventually, figure out that, like, setting up a schedule and figure out the best kind of test taking skills to help me, especially when it came to my in-service exams and residency training. And so, I think with how I did on the MCAT did affect, which medical schools I got interviews for. And it's just a different picture compared to undergrad of the range of schools that I had opportunities at. But I was really grateful to stay in state at University of Virginia. I highly recommend that school. I think, not only was it in state, but it had the feel at the time where the first couple years was pass fail. So I just felt like the students there, really smart, but it was a good kind of, they were balanced too, that you could have the opportunity, if you want to, if you are the top of your class, you can receive those accolades, get that recognition. But at the same time, it takes the pressure off, because medical school and training leader is, it's just very stressful in itself. So I appreciated being, in a more comfortable environment, but also being challenged. And then going to medical school, I was interested in plastic surgery, and but I wanted to keep it open-minded. I really strongly recommend that. I think a lot of you are really interested in medicine here, so I don't have to hound, the fact that it's a long road. There's a lot of, time, effort, sacrifice involved. It's a very singular path. You don't realize later that, there's just so much sacrifice and commitment. There'll be a time, even if you have your, your own partner, your own family, you have to put your patients first. So, I assume, a lot of you are very interested in medicine and pretty much committed. But for medicine, I would say the same about surgery. If there's something else that you like just as much as medicine, or like a surgical subspecialty, strongly consider that, because it just takes, that kind of dedication. Of course, like, to me, I don't think it's worthwhile to go into medicine, for the prestige, for the money. It's not worth it for the amount of stress and everything that you take on, and the amount of time it takes you to become a practicing provider. So, for me, and I was a little intimidated, because plastic surgery is one of the most competitive surgical subspecialties. So I say, just like how you probably have in undergrad, it says try to be as open-minded as possible when you're in medical school, of the, the specialties, the niches that you experience and rotate on. For instance, I picked OB-GYN as my first rotation. I said, I don't have any interest in delivering babies, but I was pleasantly surprised how much I enjoyed it, and could potentially consider it if I hadn't matched an ENT. It wasn't until med school that I learned about ENT. I didn't really know about it, ear, nose, and throat. And I ended up picking that and plastic surgery as my two surgical subspecialties for my third year. So you have, in your third year clerkships, you have these main rotations, one being general surgery. I do feel if you're interested in something surgical, you don't have to love general surgery, but you should enjoy it or appreciate it, again, more than medicine and peds. General surgery was by far my favorite surgical rotation. I had a lot of autonomy. I got to rotate the VA, got to assist a lot with surgery. So I really enjoyed it. After going through my intern year, and you rotate on general surgery for a good part, I would say that probably wasn't my backup, specialty if I didn't match into ENT. And then eventually rotating on ENT and plastic surgery, really enjoyed both rotations. What stuck out to me with ENT that it made it click was I really liked seeing myself as a specialist, a head and neck specialist, especially the anatomy is just so intricate and meticulous. You have your cranial nerves, you have your small vessels, and also too, there's a nice balance of clinic and operating. Like as an ENT, you can be, operating in the clinic 2 or 3 days a week between the two. And also that the surgeons themselves seem very balanced and approachable. Like just from a personality standpoint, I felt like I clicked more with them than with plastic surgery, the plastic surgeons. Also, I saw that, with ENT, the bread and butter things for a general ENT If you're not aware, it'd be like those who do sinus surgery, take tonsils out, put ear tubes in, take thyroids out, do head and neck cancer. But then you could specialize even further. So there's a route to facial plastic surgery within ENT. So I thought that was great in case if I still wanted to do plastics. Plastic surgery, is awesome too. Some things that I didn't appreciate as much, I wasn't as interested in hand surgery, which is covered by plastic surgery. And then with plastic surgery, if you match in the integrated program, which is, super, super competitive, that's a 6-year track. The first 3 years are general surgery. So, to spend that amount of time, it's really essential for plastic surgery. But for me, I wasn't as interested in it. And then you do the plastic surgery part later half of the training. Besides hand surgery, I also wasn't as excited about wound management, like thinking about managing, ulcers, like DQ ulcers and such, just not as interesting to me. And I felt like too that for plastic surgery, especially go the craniofacial route, it just takes a lot more time. You have that 6 years plus maybe, another 2 to 3 year fellowship. With ENT facial plastics, my training was 5 years residency and then 1 year fellowship, which really isn't too bad at all. Like if you want to do medicine and you go into cardiology or GI, you're doing 3 and 3. So really, it's not that too much, time. When I applied to ENT, I applied amongst 10 people, which was like a lot, like unheard of. We had a class of like 160. So that was also like pretty intimidating. And I'm sure you guys have maybe heard of the word gunner before, but also when you know, you might express interest in a more competitive especially you kind of have a little target on your back or can be seen as a gunner as well. I think the cool thing about ENT, even though it's even more competitive now, is that you definitely need certain baseline scores and things on your CV, just like applying to medical school. But I think the programs and the surgeons in this field look for you as the overall package. Like, do you not only have some the mindset, the knowledge set, some skill set, but also like the personality that fits ENT. So for my step 1 exam, I would say I was, again, and this is me learning more and more that, I'm someone who's just not as a good test taker compared to, you know, the peers who just have a knack for doing well in exams. But I was very average with my step 1 score. I did make up for it by doing really well, like 20 points higher in my step 2 exam. Got some research under my belt with some projects and did an away rotation. So I think if you really, hopefully I'm a testament to, I wasn't, the top of my class. I wasn't AOA. I was class president at UVA. But if you just have that passion and you put that hard work towards it, just like applying to medical school, I think anything is possible. And you also want to, like, if you apply to something super competitive, you want to have a backup plan when it comes to the match. For me, I didn't have that definitive backup plan. I would have either thought about taking a research year and applied again with applying to something else, or thought about doing a 1 year general surgery internship, to keep the training going and reapply as well. But it's scary, it's scary to, kind of, or anxiety provoking to apply something that's very competitive where the possibility of matching is, pretty real. So I ended up at University of Kansas in Kansas City for my residency training. Never thought I'd end up in the Midwest, but there's a lot of strong programs there. I spent 5 years, again, tried to be as open-minded as possible, was really appreciative for the strong clinical training I had there. And ultimately, facial plastic surgery was still what called out to me. What I realized, through the process of med school and then my surgical training is that, a lot of times the field of medicine you choose is not only because it's what most interests you, but it may be something that best suits you in terms of your personality characteristics. So, you've heard the stereotypes, like say, emergency medicine doctors can be a little ADD, and they might say they have the best lifestyle because it's all like, they have shift work, anesthesiologists, they like to be procedural. They don't have to go to clinic or follow patients long term. Radiologists, they're super smart. So while they can sit in a dark room all day, they're very, visual with what they do. I think for me as a surgeon, particularly a plastic surgeon, again, I love the sense of immediate gratification, to be able to deliver immediate results. And for me, even if it's more on the cosmetic side, like to be able to see a patient smile and look good and feel good and be more confident, I think that goes a long way for me. It's meaningful to me. I also like to work with my hands, be very procedural. I'm also detail oriented. And sometimes, that backfires where, I've recognized that sometimes I don't see the big picture as well, but you want your plastic surgeon to, pay attention to the details with the face. A millimeter change can make a big difference with what I do. I don't mind suturing. And sometimes too, you think about what's the most difficult kind of patient in your field, and are you you're okay with that? So for me, the most challenging kind of patient is the crazy cosmetic patient, which I deal with maybe more often than not, but I'm okay with that, as long as if they're reasonable, or I learned the challenge of saying no, that maybe I can't best help them. But for instance, like in ENT, there's otology, which focuses on skull-based disorders, ear disorders. Their challenging patient is the dizzy patient. To me, that's not appealing at all. So there's some things about ENT that I don't like, that much. And so again, you'll figure this out as you navigate through the process. But it's cool. It's neat to see, I feel really fortunate to have found, a field that not only I enjoy, but also I think it suits my traits and some of my strengths really well. So after University of Kansas, I then went to Chicago, University of Illinois, Chicago, to pursue a 1-year fellowship in facial plastic and reconstructive surgery. And it was more on the cosmetic side. After that, I applied for both academic and private practice jobs. I'm happy to talk about more of the differences, there with different types of jobs out there in medicine from my perspective. And I took on a job with a dermatology group in the Philadelphia suburbs. My first practice, unfortunately, didn't work out, which is okay. And then now I split my time between 2 offices, a med spa in the suburbs and a dermatology group in the city, and I'm an independent contractor. Currently, my practice is more cosmetic. I'm cash only, so I used to take insurance. It has its pluses and minuses. So it's kind of straightforward from a compensation standpoint. Your patients are very healthy. You are, in a way, perform more, mainly aesthetic, more superficial treatments. A lot of times I do miss the reconstructive side, but I, enjoy the aspects of being in private practice where you have some more control over your work-life balance. My husband will say I still work, all the time. But, for instance, like today I'm working from home. I had a lot of marketing things to do. I had meetings and such. There's always something for me to do. But also I don't round at the hospital. My hours are just confined to when I'm in clinic or when I have an operating day. I don't work on the weekends. And currently I only take call for my patients. So I don't take any ER call or any hospital call, which is nice. So when you think about facial plastic surgery, you have reconstructive and cosmetic. And then so I'm going to kind of touch on what the different kinds of procedures or niches within facial plastic surgery. It's really cool to me that even within this singular subspecialty, there's a lot of variety, and my peers and mentors in the field, either cover a small portion of this, or, they're kind of the jack of all trades. Reconstructive side, facial plastic surgeons are a lot of times involved with facial trauma repair. So not only lacerations of the face, but if you break bones of the face, like your nasal bones, you have a jaw fracture, we are the surgeons that can help repair those fractures. Also, cancer reconstruction, head and neck cancer reconstruction. So if you've had a dermatologist with you guys, there's Mohs surgeons. They are dermatologic surgeons who take out skin cancers in piecemeal fashion, and they use it with a microscope to create the smallest defect possible. A lot of times these surgeons can close their defects on their own. But if the defect is too large, or if it's in a delicate area like the nose or the eyelid where they don't feel comfortable with, facial plastic surgeons then can be the ones to perform that reconstruction. Now, if it's someone with a history of smoking and alcohol use and they have a bad head and neck cancer, like one that occupies a lot of their tongue or their jaw, these are cases where head and neck oncology surgeons usually remove the cancer, and then either those surgeons or facial plastic surgeons who are trained in this can do free flap reconstruction. This is a really awesome kind of reconstruction, a bit intense, so I didn't choose to pursue additional training with it. I did help take care of these patients and operate on these and assist on these surgeries as a resident. But essentially, say if you have part of your jaw or your tongue missing, you can take a free flap, typically from, like, say, your arm or leg, with soft tissue, skin, and maybe even bone, and then you place it in the defect. You connect it in by reconnecting a local vein and artery in the wound bed to a vein and artery in the free flap, and it survives. The patients are in the hospital for up to 2 weeks, but it's a really cool procedure. Also with reconstruction, there's the congenital side. So there are facial plastic surgeons who do cleft lip and palate repair, hemangiomas, other craniofacial deformities. I would say if this is something you're really interested in, it is historically covered by plastic surgery. So I'd recommend, if you want to, open up the opportunities as much as possible for that type of training and practice, to go the plastic surgery, general plastic surgery route. And then also facial paralysis is something that's covered by facial plastic surgeons. So patients, whether you do non-surgical like Botox to help with synkinesis, or you can perform surgical procedures to improve the facial, asymmetry, and it can even be done from a motor standpoint to restore some function in a patient's face. The cosmetic side, rhinoplasty is it's one of the most difficult surgeries in plastic surgery, but it's actually one of my favorite. It always humbles me, where to me it requires both like a mathematical intuition, where you need to think about the proportions of the face and the nose relative to it, as well as having an artistic eye to what is considered aesthetically pleasing, as the nose is a central part of the face. With rhinoplasty, it's typically performed to help improve the outer appearance of the nose. And then if you think about functional rhinoplasty or septal rhinoplasty, it can also be performed to help improve the breathing function of the nose. As someone who's ENT trained, I have a good understanding of how to respect the integrity of the nose and the breathing function of it and the internal structure. So it's always important to think about form and function when it comes to rhinoplasty. Also with cosmetics is aging face surgery. So that includes eyelid surgery, facelift, neck lift, brow lift, also surgeries to do contouring, like buccal fat removal. It's something that's very in vogue on Instagram. Liposuction, submental liposuction, and I do a lot of injectables in the office. That includes your Botox and filler for rejuvenation, where I help older patients take time off their face, younger patients to get more definition, more contour in their face as well. So, okay, so what I'll do here is I'm going to showcase a couple of example patients just before and after. And then afterwards, we'll open up for any questions you all have. So I'm going to share my screen here. Okay, so we have this wonderful patient here in her 50s. So the image on the left is her before image, and the image is on her right. I guess since we have a couple of you guys here on the Zoom, anyone want to guess any kind of treatments she's had done, particularly one type of surgery.
A facelift? I'm
Okay,
not
so we have
sure.
we have one guess. Good. Anything else?
It seems like something with the eyelids, maybe. Maybe some Botox.
Okay. Good. Okay, good. You're almost there. So yes, so the eyelids. And again, and what I tell patients, is my treatment goals with each patient is to help them achieve beautiful natural results. But once they're well healed, that they look and feel good, but we can't obviously tell what we did together. So it's always like a compliment to me if a patient comes back and says, yeah, like someone could tell that I look better, but they weren't exactly sure. They asked, like, did you get some more sleep? Did you go on vacation? Did you get your hair done? And this is even like getting facelift surgery. So what I'll do first to mention is she did have some injectables, like some Botox and then cheek filler. So you can see kind of her cheeks were more deflated on the left side, and the right side now they're a little bit more defined and filled out. She also had some lip filler as well, but from a surgical standpoint she had eyelid surgery. So if you see on the left side, her upper eyelids have this little bit of heaviness here. And I tell patients the eyes usually show the earliest signs of aging. So if we can do things to refresh the eyes, the mid face, first, then it goes a long way, sometimes more than doing treatments in the lower face, especially when it comes to injectables. So now if you see her eyelids here on the right with some of this heaviness off, the scar is usually just in the crease of the refreshed eyelid. And then here as well, that her eyes just pop more. She just looks more awake. She looks younger just with this one maneuver, this one surgical change. And then, so when I saw her at 1 week out, she was looking great. I took the stitches out, everything was fine. 2 days later, so at 9 days out, she contacts me in the middle of the night stating that her dog accidentally jumped up and bit her in the eyelid. So, and unfortunately, she was in the ER. They, couldn't get to her quickly enough. So I, brought her to my office and I took a look and repaired her overnight. So the next image that I'm going to show here is her, let's see, her laceration. So luckily for her, this looks like it seems pretty bad, but luckily for along the eyelid, what happened is that it's just the incision just opened up. She didn't lose any tissue. So which is great, because if she lost tissue, then it's a bigger reconstruction issue. So when it comes to laceration, usually we like to repair these within 6 to 8 hours because the face is starting to heal, and you're worried about risk for infection. So when I saw her, I thoroughly cleaned out everything. And she has these lacerations here, on her nose and kind of the corner of the eyelid. And lucky for her, as well, her eye was fine. There was no injury to the actual eye, the globe, and it was just all external. So I repaired her. I'll show some interval pictures here in a little bit, but also keep an eye on this corner. It's medial canthus, this medial corner of her left eye here. She developed two issues that actually resolved on their own, which is great. It's just due to the where the lacerations were located, the nature of the repair. But as you can see here from the left for her trauma, and then this is still her final result, that you wouldn't obviously tell that not only she had eyelid surgery, but she also had this significant laceration that she still healed up just fine, which is really fortunate, and still happy with her surgical results. And then you can see here again, despite the history of trauma, that she's got some redundant skin here on the left, and the eyelid incisions, you can see the scars that 6 months out are really faint and they're within the crease of the eyelids. And that's my goal as a plastic surgeon. Like, if we need to create scars, we make incisions, we try to conceal them as best as possible, usually like within or parallel to standing wrinkle lines, or other what we call it relaxed tension skin lines in the face. Okay, and this is her at about this is probably a month out. So this is her when she already had the trauma, and now she's healing. And the two issues that I will point out, which you'll again see with her final picture resolved, is this webbing that happened here, which luckily just softened and got better on its own with medical management. And then she had what we call a ptosis of the eyelid. Ptosis itself is something that can be repaired. Usually oculoplastics or eye surgeons repair this issue, but what ptosis means is different than having heaviness to the upper eyelid, but also if the upper eyelid is turned down a little bit where the eye aperture is smaller. So I consulted with a couple colleagues. They mentioned that likely it's just due to trauma and swelling of the eyelid. I went back and made sure this was not due to my original surgery. But the good thing is with time, these two issues improved and resolved overall. And as you can see here, again, just the webbing is very minimal, and then her ptosis resolved, and again she just looks like she had mainly just a cosmetic surgical result. This is something to show you. This is before her trauma, but 1 week out, expected bruising and her incisions. And this is after her trauma repair. So you can see just with the extra repair there that kind of just set the clock back a little bit on her healing from the cosmetic surgery standpoint. And I'm just going to kind of show just some lateral and oblique views here, again, just to see just from a cosmetic standpoint how she has more eyelid show and she looks a bit more refreshed. Okay, and then I have one more patient. So this is a patient from a non-surgical standpoint here. Okay, so looking at this patient, and again, not sure how many of you, have looked at patients who've had non-surgical treatments. Any guesses on what she's had done at all, or any of you can maybe point out any changes to her face that makes her look better, and hopefully you think she looks better on the right.
It seems like her eyes are a bit brighter, a bit more open.
Mhm.
Also, it seems like she's got a little bit more fuller lips. So I'm assuming maybe some lip injections.
Okay. Anything else? Anyone
Sure.
else have any?
Did she get Botox on her crow lines, whatever these
Okay.
are?
Yeah, that's a good thought. Anything else?
I'm not sure if I'm right because I was wrong the last time, but to me it seems that her face seems to be a little skinnier and her jawline seems to be a little more like triangular, a little more defined that way.
Good. Very spot on. Good. So basically, it depends on the patient. A lot of patients nowadays, with the advent of non-surgical techniques, minimal downtime, less risk. A lot of patients just want to do as much non-surgical. They're scared about surgery. And so sometimes we can get away with a lot of small tweaks that contribute to greater changes. So when I talk to patients about the aging process, especially with female patients, ideal youthful face is one that is kind of a V shape and more contour, like inverted pyramid. As we get older, gravity pulls things down and we lose volume. So the mid face isn't as projected, isn't as defined, and the lower face tends to be heavier. So this patient who saw me, she's a fitness instructor. She's in great shape, and it's not like she has like much laxity or anything. She actually looks great for her age. But what I noticed here on the left, besides that she needed some Botox to soften wrinkle lines, and maybe some filler here and there to give a little more lift and definition. But what I saw also, that stuck out to me is that she looked a little masculine, like harsh here, just because you think about, even if she's got some good definition, she looks a little more square, especially in the lower face, not necessarily soft, but she actually could benefit from looking softer with injectable treatments to feminize her, give her some more balance and harmony, and also overall then that creates for more youth for her. So I did some Botox the upper third of the face. I'll show in a smile, like when in a smile picture where you can really see the crow's feet soften again. It's hard to see, static view, but usually here, these are 11 lines you soften, forehead lines, and around the eyes. And yes, I agree, just especially when you soften these lines, this orbicularis oculi muscle, then the eyes pop out more. I did a little bit of cheek filler just to kind of give her a little bit more lift. And then I also placed some jawline filler, which I'll show you a little bit on especially on the right side, it smooth things out a bit. And then to me, I love, this is a different use for Botox, but if you place Botox in the masseter muscle, so it's this muscle right here, it can be used to help relieve TMJ pain and to, slim this masseter muscle, that by slimming this, especially when I'm putting some filler in the cheeks, it helps accentuate and gives more of that V-shaped structure to the face. For instance, I have a lot of Asian patients who, either TMJ issues or because they have that rounded face, want me to do just Botox injection, to add some more contouring to their face. So I'm going to go through, some pictures here, just again, show you different views of the results. So again, if you can see kind of up close, see just how more bulging and bulky her muscles here in the lower face. And just with this one treatment, I really love it, where it just brings in the lower face, and helps her look more contoured and a little bit more feminine. And this is where you can see, she has kind of the crow's feet lines here, and they're softened with the Botox. And again, she just looks more, feminine and refreshed on the right side. And I think I did one syringe total in the cheeks, but just see from a light hitting the face from a dimension standpoint, how it just helps give her more youthful look, more proportion, more definition. I love seeing here too. Again, she doesn't really have that much, lack of jawline definition, but just a little bit jawline filler here, just, brings that extra sharp edge. And again, just some cheek filler gives her some more definition and makes her look more refreshed. Okay. Perfect. Okay. So, thanks so much everyone for hearing me, share a little bit of my experience and my background and some cases here. So I'd love to just open it up to any questions that you all have.
Yeah, thank you so much for going through your background and everything. One of the first questions that we have today is that you mentioned in undergrad you were a neuroscience major. So why did you choose that? And did you use any of this at all now?
So neuroscience, I liked that it was a blend of like biology, science, as well as psychology. It was like a newer major when I was going through undergrad. So even if I was interested in plastics at the time, it had nothing to do with that. And ultimately, kind of unfortunately, it's I don't use, that knowledge much anymore. I think regardless of, what you major in, I think the important thing is, it's always appealing definitely to major in a science major in undergrad, because with the overlap with the pre-med classes, it works out well. But, depending on your schedule and especially your room for it, I really recommend to major in what you really enjoy, because we only go through college once. So that's why I had a little bit extra time to do international relations as well, kind of do like a global health focus between the two majors. Yeah, just I don't know, maybe because it just wasn't like biology or chemistry is why I picked neuroscience.
Yeah, that's awesome. Following what you enjoy and kind of going back to that international aspect that you talked about. As a physician now, have you had any opportunities to continue on with medical service trips, or do you plan on it in the future? What do those opportunities look like as a facial plastic surgeon?
So I really want to be able to do it, hopefully in my practice. I'm just a couple years out. I did do medical admissionship and residency. I thought it was really cool that my own resident program promotes that for senior residents. It's what drew me to the program as well, that they sponsor a trip for you to go to. I went to Guatemala and I did some ENT, cases there. So definitely, like, regardless of what, specialty you're in, if you're interested in having international outreach or doing that, there's definitely opportunities there.
That's really cool and interesting. I think a neat part of medicine is that you can practice here in the United States and do all that, but you can also take it other places. And there's so many different fields and interests. And so we had a question asking, at what point in your career did you decide and make the decision to specialize more in facial plastics rather than the hand surgery? Was it once you were already in your residency and looking at fellowships, or was it kind of when you went into your residency? At what point were you able to make that distinction?
hmm So I think first, what I decided in terms of going down the ENT track versus general surgery, general plastic surgery track, was once I rotated on both. ENT and plastic surgery in third year medical school, and just kind of saw the contrast more, whether just the personalities, being around the surgeons and what each specialty covered. That I just felt like ENT clicked more with me, and I didn't want to get my hopes up that I was going to do facial plastics later, but just saw that there was a road to that. But at baseline, really enjoyed ENT most as a surgical subspecialty. And then I think throughout residency, and try to be open-minded, but I early on, it just, my draw to facial plastic surgery just never went away. Enjoyed the research projects I did with it, the mentors that I, who are facial plastic surgeons at KU, they're my closest mentors still from that program. So it just naturally fit with how my evolution of my training. But still, like, I still feel lucky that I had a well-rounded training, and that there are certain cases, like I missed the head and neck oncology cases a lot, just because you can't do everything. So yeah.
That's awesome. And we can tell that you're super passionate about the field that you chose to go into, which is really awesome and exciting for people who are hoping to be physicians one day. Is there one of your favorite memories of working with a patient, and how does it feel to change people's lives, not only physically, but also like mentally, how they feel about themselves?
Okay, that's a good question. So again, I think for me, like, you can say, well, I've changed people's appearances or lives maybe more on a superficial level. There's times too when I think, okay, this really high maintenance patient, like, what am I doing? Or just, when you just have sometimes those tough moments where, not every patient interaction is stellar. I think for me at the end of the day, to help instill more confidence in someone, and when they come back and they're smiling, and they look good and feel good, that that connection and sharing a smile, I think that goes a long way. And also feeling privileged to have someone trust their face in me. I've started to realize and appreciate that's a big deal, even if I'm just doing some Botox or filler on a patient. And and from a female surgeon perspective, I've also come to appreciate, like, a lot of times as a female, you think, oh, you have these obstacles, which you do. Like, there are still barriers. They're coming down, but barriers in training, being among your peers in medical school, and then being a surgeon. But I've learned that being a female surgeon has its advantages too, especially in facial plastic surgery. The majority of my patients are female. So, for them, I hopefully can be someone who's, very relatable and approachable. I have a lot of young female patients. I have Asian patients, seek me out just because, they just see me, whatever, on my website, and they think because, we look more similar, that we share more commonality. The name of the game now, even because of social media, I consider Instagram as a necessary evil, but a lot of patients look up their surgeon first on Instagram before they, it's not like, oh, what medical school or residency program did you go to? They'll look like, okay, what reviews do you have? And then they look on Instagram to see if this is someone who, who I connect with, basically. I'm trying to think, let's see here, a really kind of rewarding kind of experience with a patient from a, facial plastics standpoint. So let's see here. I think a lot of times, I don't do this as much, but the reconstructive cases, I think, go a long way. Like I remember a lady who, a dog like bit her in her lip, very traumatic experience. Or just with that patient I told you about, the one who, with her eyelid, that, let me talk about her. So at the time, I was like, 7 months pregnant, I think. And so I'm thinking, like, I'm laying in bed when she like texts me. I'm thinking, what I do, I'm not on call. But at the end of the day, you just think about doing the right thing for the patient, right? Like if they were your mom or your family member. So it was like midnight, 1 o'clock in the morning, got out of bed, super pregnant, and I took care of the patient, and at the time I just wasn't sure. And I asked a couple colleagues for their advice, because you could kind of sit on it. But in the day, not only I'm really happy with the results, but with that patient, to her, it just, the appreciation and such that she had, and since then, and she's like, one of my kindest patients in my current practice, I think, says so much, goes along again. And you feel like, okay, when you feel like you just did the right thing, and you should always do the right thing, for the patient, that, that kind of gratitude and, impact we have for a patient, I think it just goes a long way.
Absolutely. And that's a big role as being a physician, is kind of catering to the patient and doing the right thing for them. Going back to what you said a little bit earlier about being a female in medicine, and also you touched upon you were pregnant and all of that. What's your work-life balance like, and how is it being a surgeon with also being a mom? Any insight there?
Okay. So I really, now since being a mom, I really like admire, applaud all moms out there, and also women who have babies in residency. I don't think I could have done it, and now, I have that greater appreciation, because it's just such a humbling experience. So for me, I got married. I met my husband in residency. Like he was like the first person I met outside the hospital in intern year. And then we dated throughout residency. We got married right after fellowship. And we decided to, I recommend this as well. I took 5 months off after fellowship before I started working in Philly. So we traveled to Europe for 5 weeks, and we got married that October, because I had gone straight through. So, and especially now thinking COVID times where we can't travel, we feel at least grateful to have that experience. And then, wanted to take my time to build my practice first before we had our first kid. When he was born, for me, the sleep deprivation wasn't too bad, just having gone through training and being on call. But the loss of autonomy and kind of sense of efficiency and your time, and independence, I think was a big deal, especially for myself as a surgeon. So, we have a really happy, healthy boy. We're really lucky and grateful for it. It's basically, I've learned to just take it one day at a time, especially as a mom. And sometimes there's, bad days, like, and it's okay, or, more challenging days. I think if you have, the right support system, like my husband, he's able to work from home and take care of him, which I think is even, much more, because like, for instance, when I work from home, I take care of our son, I don't get much done. That's just how it is, especially since I'm still breastfeeding him. But the fact that my husband can do that for us, I don't feel as guilty that it's a stranger taking care of our son. And he supports me in being able to work, full time, I think is a big deal, because I don't see myself as a stay-at-home mom. I just couldn't do it. But every day, you just take it I think you just take a day at a time. And if you have a good support system, it works well. The nice thing too, now being a mom and a surgeon, is that it's an extra thing I can relate with my patients more. So I'm just more and more finding common ground where, they ask about my son, how they're doing, or we talk about, our kids, that I never thought about it. So there are times I don't even think of myself as a mom. I think we just have this, like, I've never had a pet. So that's like little creature that we just, I don't know, take care, keep alive. And he, whatever it is. Again, I'm not super, warm and fuzzy. Like for me, peds or kids, it's fine. I'm not like, I like talk, like I like kids who can talk with you. I think that's the best age to me. But yeah, it's been okay. Like I think overall, I'm very happy to be a mom, and it's given me more perspective. It's tough too, where it adds more to that work-life balance challenge. That you're just juggling all these balls. I now, I'm always working, as my husband says, but I now am cognizant of, okay, clinic notes. I need to maybe really, like, I can't chit chat in the office as much. I really have to, use my time well, so that otherwise, if I'm at home doing notes or catching up, that takes away time with my family. I don't try to stay around in clinic. I try to be more efficient with my time, because anytime, that I'm spending away from home, I'm spending it, or with work, I'm spending away from my son.
Yeah, that was a really great answer, and it kind of gives like a holistic perspective on what it's like to have a kid after you're done your training, and kind of taking that time for yourself. Now, being in the field of cosmetic surgery, trends are always changing. And so, how have you had to adapt to that, or is that something that has become challenging within your field?
That's a good question. So I would say one uh, thing about plastic surgery, and I have to be cognizant of, as well as the stigma associated with plastic surgery. I think with social media and, information being more prevalent online, I think the stigma with plastic surgery is going down, which is good. I think, potential patients have more access to, information, awareness on procedures. I think celebrities who are open about what they do, I think helps with that. But at the same time, there's still, more progress to be made. When you have things like, bullying and trolling, on social media, I think a lot of, others out there can be judgmental, and for me too, like if I am helping patients achieve, their treatment goals, and I'm doing things to, improve themselves aesthetically, I myself shouldn't judge, or should be as open-minded as possible. I think it's one thing to make sure that we are on the same page regarding expectations, but, say a patient, wants, if I think their lips look fine, but they want to augment their lips, as long as it's within realistic expectations, I myself, if I'm performing these treatments, shouldn't judge someone else if they want to pursue them. So definitely, like on social media, and with what's out there, and you all probably seen it or maybe encounter a bit. There's also the perspective of, making sure that your patients are educated, or that they have that foundation, versus misinformation. So I think it's more so in other, specialties, especially when it relates to COVID, what's and our, public commitment, like wearing masks and such, and the vaccine. But for instance, there's been a lot of hype of, oh, there's been some filler patients who had swelling and they got the COVID vaccine. Well, a lot of, plastic surgery colleagues and injectors have come out, to say, well, you look at that study, it was, I think, 10 or 20,000 patients, and only 3 patients got swelling with it, have a history of filler. And in general, any patients with filler can have swelling as a side effect, whether it's allergic reaction or it's a delayed hypersensitivity reaction down the line. So really, you can't equate to the vaccine, necessarily being associated with swelling, and swelling just happens, with filler patients. And to me, I think I don't use that into the argument. I think, filler is an elective procedure, how getting the vaccine is a personal choice, but it's a, from a public health and your own personal health standpoint, I would strongly recommend getting the vaccine, regardless, over thinking about having filler or not, or a history of filler. I think also, again, that's a good question. You ask, right, with like misinformation, or whether it's like, patient results and such. I usually try to achieve, to obtain, conserve natural results. So, some of the things out there, I have to talk with patients, hey, you need a lot of product, or a lot of this certain treatment to get the results you want. We also have to be realistic too. We're in the era of the selfie, so patients who kind of take pictures of themselves, and they might say, oh, but I like how this celebrity looks, or, how I look at this angle. I think it's fine, to again have patients come in and show pictures that they like, especially for rhinoplasty. But we always have to be cognizant to reestablish what is considered realistic expectations, for the patient and ourselves in whatever treatments we're doing together.
Yeah, that's a really good point. And as we're wrapping up here, we just wanted to ask you if there was any advice that you would give to yourself as a pre-med looking back, and if there was anything that you would change throughout your journey up until this point.
Okay, that's a good question as a pre-med. So, I would two things. So personally for myself, I think I would have emphasized more like maintaining good study habits, and being more cognizant of preparation in terms of test skills, and being able to having testing strategies. I ended up getting like some professional help during residency, which was great. I think that reflects too, like if you're struggling, always, it's always the hardest thing to ask for help. You'll realize it over and over again, but asking for help, it's not a bad thing to do. It doesn't show sign of weakness. A lot of times it's a great thing, a sign of strength, if you realize, where you're deficient and you need more help. So, for me, again, I wouldn't change necessarily like how I don't think I could have done, been on top of my class score wise by, investing this many more hours and such with school. But I think having that mature understanding of that, I think I could have, then set myself up better, in the long run of, in terms of my study skills. The advice I would have in general, and I think, again, I don't, maybe just being more cognizant of this, is that the road to medicine, being a medical specialty, is a long one. So, besides having the focus and such, make sure that you're someone who can, seek out other opportunities that make you well-rounded. Because we only go through, whether you call it, I don't want to sound too cliche, go through life, go through this trek, this journey once. So, don't worry if, say, you aren't have everything ready for being pre-med and applying to med school yet. Maybe you need to want to take a year off, or maybe after you apply, you want to take a year off. Like, don't hesitate to do that. I think the average age of med students now are older. And I think those students, compared to me going straight through, had maybe that, more mature focus when it came to studying and doing well in medical school. But again, if you need to take a year off, or you want to do the other major, or whatever it is, or think about that different kind of rotation or summer experience. You only have one summer in medical school. Like, take advantage of it if you have some other interest or passion, and always think about self-care, like even in your training to, I'm glad I'm someone who always tried to look for, a live music concert to go attend, or go out to eat with my friends during residency, instead of like staying all weekend to study. I think that's just really important, because you yourself like want to, be balanced and rested, because if you don't have that, then you can't, implement good patient care for your patients. So again, it's a long journey, a lot of time and sacrifice. And so, again, pursue whatever you enjoy too, at the same time, or it's okay to take your time, to eventually get where you are in medicine.
Thank you so much, Dr. Tina. I want I want to let everybody know, make sure to follow her on Instagram at Dr. Tina Ho and visit her website at drtinaho.com. Also, we released the quiz, so make sure to fill that out and take your time on that so you can really reflect on what she said and you can get the most out of it. Again, we have our next session with Dr. Malavi on the 28th. So we hope to see everybody there. Make sure to like, subscribe, and we'll see you guys next time.
Perfect. Thanks so much for having me. And feel free to share my email or send a DM. Like, I'm happy to help.